And we are back with the Pop-Up Studio here at GDHF 2024, Day 3. I'm joined by Ann Stake, co-president of Medtronic Labs. And Medtronic Labs has been really present this year at GDHF. Tell us a little bit about what you have been contributing and what that's meant to your organization this year.
Yeah, absolutely. Thank you so much. It's been an amazing event so far. I think the first time it's on the continent is fantastic. We have a huge team in Nairobi, so we have a presence here because we have about 50 staff on the ground.
50 staff? Oh my gosh.
Yeah. So we've been really, pushing our vision around integrated primary care that actually delivers value to health systems. So all about how do you actually measurably improve health outcomes and measurably reduce costs to the health system through digital innovation.
Cost reduction is something that I think we have not heard enough about, and you are really driving that conversation. I mean, what are some of your reflections, having been contributing to the conversation, but also listening and participating as more in the background on some of these other panel discussions and workshops? What are some of your takeaways?
Yeah, absolutely. I mean, I think there's been a lot of focus on pure digitization and technology, and we're really trying to change the conversation in digital health to think about what does transformation actually mean for health systems? It's not just about digitizing a form, but it's actually about looking at those metrics really rigorously. Sustainability is something that I think everyone's trying to figure out this year, and so if you can actually show that at the community health level, you're able to improve outcomes for really complex diseases, malaria, hypertension, diabetes, it actually saves money for health systems in the long term, so you can really start making this value-based care argument and really kind of pull all of these different threads together into a cohesive story for a Ministry of Health, for instance.
It's such phenomenal work. It's so important, and I'm just really grateful that you all are really driving this conversation. I think it's something that a lot of people care a lot about, but you all have shown a lot of leadership this year in trying to really bring that to the fore and really thread it all together. So when you think about the future, Anne, and you think about what Medtronic Labs is doing, how would you describe that sort of like hope that you may have for the digital health space in 3 words?
Absolutely. I would say collaboration, sustainability, and design. Collaboration, because I think to date there's been a lot of fragmentation in this space. I think that's natural, but with a lot of the efforts now around digital public infrastructure, around FHIR and interoperability, we're at a moment where we actually can see more collaboration happening, more local innovators coming to the table, and I think that's critical if we're going to create a vibrant ecosystem that actually drives outcomes. I think sustainability, as I was saying, is on everyone's mind, and we need to figure out what that model actually is in the long term. It's not just about donor funding or continuous dependence on that. We have to actually create viable business models. We have to think about what that value argument is. And then, of course, I think design is something that has been ubiquitous, but now in the age of AI and machines, I think actually leaning into human-centered design in a more rigorous way will be key, involving local communities and actually thinking about what the future is for this kind of AI-powered future is going to be absolutely critical.
No question about it. And thank you so much, and
Thank you.
Have a wonderful rest of the conference.
Thank you so much.